Hi, I'm Dr. Will Holdsworth, your San Jose chiropractor from Pain Relief Chiropractic. This video is about whether or not chiropractic can make you a healthier person in general. Even if you were getting healthier from chiropractic, how would you even measure that? Well, let's start real quick. We'll take a step back. Treating patients with chronic pain, low back pain, even disabling pain can be very tricky, whether you're a chiropractor or another health practitioner. Now, in the medical field, a very common approach that is used is to treat patients with opioid pain relief medication. Opioid pain relief medication is hydrocodone, oxycodone, methadone, something like that. And this is only really used by medical doctors usually after a less invasive approach has taken place. Now there's guidelines that have been published to basically keep us all in check, all doctors in check, for how we should be managing chronic low back pain, and it's very clear that we should be using the least invasive and less dangerous approach first before we jump to more invasive, more risky procedures. The Center for Disease Control and Prevention, the CDC, did a report in 2007, and what they found was that nearly 100 people every single day in the United States are experiencing a drug overdose. Most of these drug overdoses are caused by prescription medications, and there's 3 times more of these prescription drug overdose medication as opposed in 2007 as opposed to 1991. Also, there was 98.4% of an increase in emergency room visits between 2004 and 2009. This equates to 1.2 million more ER visits related to misuse and abuse of pharmaceuticals. This is also higher than ER visits for people who are getting into the ER based on heroin or even cocaine overdose. Prescription medication is leading. Now this is important to me because I come from a rural town, New Jersey, very quiet place, but there is an opioid problem there for sure. I know a lot of people who've had overdoses. I know people who have gotten hooked on opioids based on some sort of initial treatment that was being rendered for them for like knee surgery or something like that, where they were given pain medication, and these pain medications are highly addictive, so people are getting hooked on them basically. But what does this have to do with chiropractic? Let's get back and bring this to a full circle. It actually has a lot to do with it. And this is the reason why I became a chiropractor, because I know that as a chiropractor, I'll never be worried about giving people any opioids or anything that'll make them addicted to anything. The other thing is I know that everything that we do as chiropractors is a lot less risk than providing people with surgeries or drugs. Now, organized medicine and insurers are starting to take a more serious look at alternative approaches. And they're especially paying attention to chiropractors because chiropractors have the highest patient satisfaction of all the other alternative care providers. Chiropractors are generally healthier, chiropractic patients are generally healthier than the people who don't utilize chiropractic care as well, and chiropractic may be the solution to the opioid problem in the United States. Prevention of low back pain can also help people from ever going to get opioids in general. There was a study that reported that patients with work-related non-specific low back pain have a higher disability recurrence when treated with physician services or physical therapy compared to chiropractors. The study also found that when a similar patient group was treated by chiropractors, they had a lower pain severity than people who use, and fewer opioid use, and a few occurrences of surgery in general. Additionally, on average, fewer expensive medical services and shorter initial periods of disability are found with people who get chiropractic care compared to other provider types. Another study compared 1.7 million insured patients treated for low back pain by provider types and concluded that the outcomes showed that when chiropractic care was pursued, the cost of treatment was reduced by 28%, hospitalizations were reduced by 41%, back surgery was reduced by 32%, and the cost of medical imaging, including x-rays and MRIs, was reduced by 37%. So with that information, what I'd like you to do is decide whether or not chiropractic can make us a healthier country in general. You can go ahead and leave a comment if you have a strong opinion about this. I'd be sure to answer it. Thank you so much for watching. I'm Dr. Will Holdsworth, your San Jose chiropractor from Pain Relief Chiropractic. Have a good rest of your day.